Welcome to the deep dive. Today we're taking a really fascinating look into a part of our anatomy we probably don't think about much, the chest wall and pleura.
Yeah, that's right.
I've got some interesting medical insights here that show just how much our ribs, clavicles, even the soft tissues can tell us.
Absolutely. We're kind of digging into how subtle things, variations, maybe conditions in this, protective structure can actually paint a much bigger health picture.
So expect maybe a few aha moments about your own body.
Definitely.
Okay, so let's start unpacking this. Ribs. I mean, did you know they can have natural variations you might never even suspect?
Mm-hmm.
Like things called bifid ribs, where one splits, or maybe splayed, or even fused together, particularly the upper ones.
Exactly. These are often congenital, just part of how someone's built, their unique blueprint.
Right.
But what's really fascinating, I think, is the cervical rib.
Ah, yes, the extra rib.
The extra rib. It comes off the C7 vertebra, up in the neck, essentially. It affects maybe 1–2% of the population.
Not that common, but not super rare either.
Right. And while it's often, asymptomatic, it can cause problems. It can actually press on nerves or blood vessels.
Leading to that thoracic outlet syndrome you hear about sometimes.
Precisely. Things like numbness, pain, weakness in the arm. It's often bilateral, but interestingly, it can be asymmetrical too. It just shows the body's complexity.
And that leads into something else you mentioned, which sounds intriguing. Rib notching. That's not just a random shape change, is it?
No, not at all. It's quite specific, actually. It's a sign caused by persistent external pressure on the rib.
So the rib itself is reacting to something else going on.
Exactly. Like inferior rib notching that's on the underside can be a key clue for conditions like, say, coarctation of the aorta.
Which is a narrowing of the big artery from the heart.
Correct. Or even something like neurofibromatosis type I, a genetic disorder. So the rib is sort of, well, whispering clues to the diagnostic detective, if you like.
It's like the bones are recording what's happening systemically.
That's a great way to put it. But of course, not all rib issues are about systemic clues. Sometimes the issue is right there in the rib structure itself.
You mean like growths or lesions?
Yes, and it's important to know not all growths are benign, unfortunately.
Right.
While you do get benign primary rib tumors, things like cartilaginous chondromas, usually found anteriorly, often with characteristic calcification.
Okay.
The more destructive lesions, they often signal something, well, more aggressive.
And by aggressive, you're usually talking about malignant tumors.
Yes, primarily. Most commonly, these are metastatic deposits, meaning cancer spread from elsewhere, or myeloma, which is a bone marrow cancer.
And I suppose lung issues could affect the ribs directly, too.
Absolutely. Things like bronchial carcinoma or Pancoast's tumors in the lung apex, they can spread directly into the adjacent ribs. An MRI is often really useful there to see how far it's gone.
That makes sense. So what about other bones nearby, like the clavicles, the collarbones?
Good question. They can have issues like synovitis, inflammation, but it's worth noting that neoplasms or growths of the clavicle itself are usually malignant. Again, often myeloma or metastatic carcinoma.
So similar culprits, potentially.
Often, yes. It reinforces that idea that finding something in one bone might point to a wider issue.
Okay, let's shift focus a bit to the soft tissues around the chest wall. There are some pretty unique conditions there too, right? Like Poland syndrome?
Poland syndrome, yes. It's an autosomal condition, meaning it relates to genes not on the sex chromosomes. You typically see a unilateral absence or hypoplasia, underdevelopment of the pectoralis major muscle.
The big chest muscle just on one side.
Exactly. And it's often accompanied by anomalies on the same side in the hand and arm, sometimes even rib anomalies too. It's quite remarkable how these different developmental aspects link up.
Wow, that really shows the interconnectedness. What about soft tissue tumors?
Well, the most common benign chest wall tumor is actually a lipoma, just a fatty lump. Usually shows up as a low-density, pretty well-demarcated mass on a CT scan.
Okay, relatively straightforward then.
Often, yes. Then you have things like neurofibromas. These are linked to nerve tissue, and they can sometimes cause changes to the bones nearby, like making ribs splay apart, or even eroding the bone from the pressure.
Subtle changes again.
Mm-hmm.
And finally, just thinking about the overall shape of the chest, there are conditions that affect that too, aren't there?
Oh, definitely. Like pectus excavatum, which most people know as funnel chest, that's where the sternum, the breastbone, is sort of depressed inward.
Right. You can really see that visually.
You can, and it might just be an isolated thing, or sometimes it's associated with other disorders like Marfan syndrome or even certain types of congenital heart disease.
And the opposite exists too.
Yes, pectus carinatum or pigeon test, where the sternum protrudes outwards. Again, these shapes can be important diagnostic clues sometimes.
So, bringing this all together, what's the big takeaway here? It sounds like the chest wall is just packed with potential information.
It really is. I think our deep dive today shows just how, well, intricate and interconnected all these structures are. The ribs, the muscles, the bones. It's this dynamic landscape where even really subtle changes can be significant indicators of your health.
Absolutely. We've touched on, cervical ribs, the hidden messages and rib notching, conditions like Poland syndrome affecting multiple systems.
Yeah.
Our hope really is that you walk away with a bit more appreciation for the amazing complexity hiding just beneath the surface.
It's a great reminder that sometimes, honestly, the smallest anatomical details can tell the biggest stories about our health.
A really profound point to end on. Thanks for joining us for this deep dive.